Nature's Healing TV presents Rectal Cancer Warning Signs You Should Never Ignore. The early symptoms, risk factors, prevention tips, and natural supportive remedies everyone should know. Disclaimer: this educational content is for informational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Rectal cancer is a serious medical condition that requires professional medical evaluation and treatment. Always consult a qualified healthcare professional regarding any symptoms or health concerns. Introduction: what if your body has been sending you warning signals, but you've been dismissing them as hemorrhoids, indigestion, stress, or simply getting older? Rectal cancer is one of the most serious cancers affecting the digestive system, and unfortunately, many people ignore its early warning signs until the disease has advanced. The rectum is the final section of the large intestine, located just before the anus. Rectal cancer develops when abnormal cells grow uncontrollably in the lining of the rectum. Like many cancers, it often starts silently and may not produce obvious symptoms in its earliest stages. The encouraging news is that when detected early, rectal cancer is often highly treatable. Today, we will explore the warning signs you should never ignore, risk factors, preventive measures, traditional knowledge, and natural approaches that may support overall digestive health. Let's begin. What is rectal cancer? Rectal cancer occurs when malignant cells form in the tissues of the rectum. It belongs to a broader group of diseases known as colorectal cancers, which affect the colon and rectum. Most rectal cancers begin as small growths called polyps. Over time, some polyps can become cancerous if not detected and removed. This transformation can take several years, which is why regular screening is so important. Warning sign number 1: blood in the stool. One of the most common warning signs of rectal cancer is blood in the stool. The blood may appear bright red, dark red, maroon-colored, black, and tarry in some cases. Many people mistakenly assume bleeding is caused by hemorrhoids and never seek medical evaluation. While hemorrhoids are common, persistent or unexplained rectal bleeding should never be ignored. Even a small amount of recurring blood deserves medical attention. Warning sign number 2: changes in bowel habits. Has your bowel routine suddenly changed? Watch for persistent diarrhea, chronic constipation, alternating constipation and diarrhea, increased urgency, difficulty passing stool. These changes may last for several weeks. When a tumor begins to grow, it can partially block the rectum and alter normal bowel function. Any significant change lasting more than a few weeks should be discussed with a healthcare provider. Warning sign number 3: narrow or thin stools. Some people notice that their stools become unusually thin or pencil-like. This occurs because a growing mass may narrow the passage through which stool exits. Although other conditions can cause thin stools, persistent changes should not be ignored. Warning sign number 4: a feeling of incomplete emptying. Do you feel like you still need to have a bowel movement even after you've just gone? This sensation is known medically as tenesmus. People may repeatedly visit the bathroom yet still feel incomplete evacuation. This symptom can occur when a tumor irritates or partially obstructs the rectum. Warning sign number 5: unexplained weight loss. Weight loss without dieting or increased exercise can be a warning sign of many cancers, including rectal cancer. Cancer cells consume energy and alter metabolism. If you've lost a significant amount of weight without trying, it warrants medical evaluation. Unexpected weight loss is never something to ignore. Warning sign number 6: persistent fatigue. Many people describe cancer-related fatigue as overwhelming exhaustion that doesn't improve with rest. This may occur because the body is fighting disease. Internal bleeding may lead to anemia. Nutritional deficiencies develop. If you feel constantly drained and cannot explain why, seek medical advice. Warning sign number 7: abdominal pain or cramping. Persistent abdominal discomfort may occur when a tumor interferes with normal digestion. Symptoms may include cramping, bloating, pressure, gas pains, lower abdominal discomfort. While occasional digestive upset is normal, recurring pain should be investigated. Warning sign number 8: rectal pain or pressure. Some individuals experience pain during bowel movements, rectal discomfort, pressure in the pelvic region. These symptoms should never be dismissed as merely aging or minor irritation. Warning sign number 9, iron deficiency anemia. Slow internal bleeding can lead to iron deficiency anemia. Symptoms include weakness, fatigue, pale skin, dizziness, shortness of breath. Sometimes anemia is the first clue that something serious is occurring inside the digestive tract. Who is most at risk? Several factors increase risk. These include age. Risk increases after age 45. Family history. A family history of colorectal cancer raises risk. Personal history of polyps. Certain polyps may become cancerous. Obesity. Excess body weight is associated with increased colorectal cancer risk. Smoking. Tobacco use contributes to many cancers, including rectal cancer. Excessive alcohol use. Heavy alcohol consumption increases risk. Sedentary lifestyle. Physical inactivity may contribute to disease development. Diet. High consumption of processed meats and red meats has been linked to increased colorectal cancer risk. Traditional knowledge about digestive health. For centuries, traditional cultures emphasized maintaining digestive health through dietary habits and natural foods. Traditional practices often encouraged high-fiber foods, fresh vegetables, fruits, herbs, fermented foods, adequate hydration. Although traditional remedies cannot cure rectal cancer, many of these practices align with modern recommendations for maintaining digestive wellness. Foods that support colon and rectal health. 1. Leafy green vegetables. Examples include spinach, kale, ugu, fluted pumpkin leaves, bitter leaf. These foods contain vitamins, minerals, antioxidants, and fiber. 2. Cruciferous vegetables. Examples: broccoli, cabbage, cauliflower. These vegetables contain beneficial plant compounds associated with healthy cellular function. 3. Fruits. Examples: apples, oranges, berries, pawpaw, guava. They provide fiber and antioxidants. 4. Legumes. Examples: beans, lentils, peas. Legumes support healthy digestion and regular bowel movements. 5. Whole grains. Examples: oats, brown rice, millet, whole wheat. These foods increase dietary fiber intake. Classified natural supportive remedies. These are natural substances that have been scientifically studied for their potential health-supporting properties. Turmeric. Turmeric contains curcumin. Preparation: add 1 teaspoon turmeric powder to warm water. Mix thoroughly. Consume with meals. Curcumin has antioxidant and anti-inflammatory properties. Ginger. Ginger supports digestive comfort. Preparation: slice fresh ginger root. Boil in water for 10 minutes. Strain and drink. Green tea. Green tea contains polyphenols and antioxidants. Preparation: steep green tea leaves for 3 to 5 minutes. Drink warm. Garlic. Garlic contains sulfur compounds associated with health-supportive properties. Preparation: crush fresh garlic. Allow to sit for 10 minutes. Add to food. And classify traditional remedies. Various traditional cultures have used these plants for digestive wellness, though evidence for cancer prevention or treatment remains limited. Bitter leaf tea. Preparation: wash fresh bitter leaves. Boil in water. Strain and drink moderately. Moringa leaves. Preparation: dry leaves. Grind into powder. Add to soups or warm water. Source leaves. Preparation: wash leaves thoroughly. Boil gently. Allow to cool before drinking. Important: scientific evidence does not support Sorsop as a cure for rectal cancer. Aloe vera. Traditionally used for digestive support. Preparation: use food-grade aloe vera gel. Mix small amounts into water. Avoid excessive use due to possible digestive side effects. The importance of fiber. Fiber is essential for digestive health. Benefits include improved bowel regularity, reduced constipation, better gut microbiome support, healthier digestive function. Excellent fiber sources include beans, fruits, vegetables, whole grains, seeds. Why screening saves lives. One of the most powerful weapons against rectal cancer is screening. Common screening methods include colonoscopy, allows doctors to view the colon and rectum directly. Stool-based tests can detect hidden blood. Flexible sigmoidoscopy examines part of the lower digestive tract. Early detection dramatically improves treatment outcomes. When to seek medical help immediately. Contact a healthcare provider promptly if you experience persistent rectal bleeding, and explain weight loss, ongoing abdominal pain, chronic changes in bowel habits, severe fatigue, narrow stools lasting several weeks, rectal pain or pressure. Never assume symptoms are harmless. Lifestyle habits that may help lower risk. Exercise regularly. Aim for consistent physical activity. Maintain a healthy weight. Healthy body weight may reduce risk. Avoid smoking. Smoking damages nearly every organ in the body. Limit alcohol. Excessive alcohol use increases cancer risk. Eat more plant foods. Focus on vegetables, fruits, legumes, and whole grains. Reduce processed meat intake. Limit processed and heavily preserved meats. Stay hydrated. Adequate water supports digestive function. Final thoughts. Rectal cancer rarely appears overnight. In many cases, the body provides warning signs long before the disease reaches an advanced stage. Blood in the stool, persistent bowel changes, and unexplained weight loss, fatigue, abdominal discomfort, and rectal pressure should never be ignored. Traditional wisdom and natural remedies may support digestive wellness, but they are not substitutes for medical diagnosis or cancer treatment. The most effective strategy remains prevention, healthy living, regular screening, and prompt medical evaluation when symptoms arise. Listen to your body. Pay attention to the warning signs. Early action can save lives. If you found this information helpful, please share it with friends and family. Someone may recognize a symptom they've been ignoring and seek help before it's too late. Remember, early detection is one of the strongest defenses against rectal cancer. Follow Nature's Healing TV for more health secrets. This video is for educational and traditional knowledge purposes only, and it's not a substitute for professional medical advice or diagnosis. So be warned.